Normally, a sinus infection presents itself with pressure in the sinuses, with congestion, and with drainage. People say, my face hurts, I have drainage coming out of my nose, I have drainage in the back of my throat. And so it's all related to the sinuses, which are under the eyes and in the cheeks. And when they get inflamed, the symptoms occur. The diagnosis is really based on the symptoms. How long has the patient had the symptoms? Does he have fever? Does he have pain? Where is the pain? And what does the discharge look like? And so just by those answers to those questions, we can, number one, determine, does he have a sinus infection? But more importantly, is it a sinus infection caused by a virus, which over 90% of them are, or is it bacterial? And does the patient need treatment with an antibiotic? In general, a patient that has a bacterial infection will have a fever, usually over 100.8. It will have lasted more than 5 days. The discharge that they're having from their nose or coming from the back of the throat is going to be really discolored, deep green, even toward the brownish color. On the other hand, if there's no fever, there's no discharge, there's no severe pain, it's only been a few days, it's generally viral in nature. We tell the patient that they should breathe in steam. And we say get in a really, really hot shower for 10 minutes twice a day. And by breathing in that steam, it helps with the sinuses. It helps relieve some of that inflammation. We also recommend that they use a vaporizer at night so that while they're asleep, they don't dry out their mucous membranes. In addition, a non-drowsy antihistamine decongestant is very, very helpful. And frequently we use a cortisone nasal spray, which really relieves some of that inflammation. Well, in my experience for the last 30 plus years, and I've practiced in an office, in urgent care, and certainly in an emergency room, and now for the last 7 years doing telemedicine, there is no question that it is easier, safer, and probably better to utilize a telemedicine service for a sinus infection. And the reason for that is simple. The diagnosis can be made without actually examining the patient physically. The exposure to the patient to other sick people doesn't exist if you treat them using telemedicine. And frequently, they're overtreated when they wind up in an urgent care or in an emergency room in terms of testing. So if it was my family and someone that I cared about that needed treatment, I would certainly use telemedicine as a preference rather than urgent care or an emergency room.